The World Health Organization's Eastern Mediterranean region is a diverse zone of high and low-income countries, deserts and snow-capped mountains, state-of-the-art research facilities alongside zones of conflict, and complex humanitarian crises. What are the health priorities in this complex setting, and what are the prospects for international collaboration to address them? On today's CommonHealth Live, Dr. Hanan Balkhy, WHO's Regional Director for the Eastern Mediterranean Regional Office, shares her views on the opportunities and challenges for public health in this setting.
This is the CommonHealth from the CSIS Bipartisan Alliance for Global Health Security, engaging senior leaders on questions of how to address our common health security challenges in this post-COVID moment.
Hello, this is CommonHealth Live, the broadcast and podcast of the CSIS Bipartisan Alliance for Global Health Security. Welcome to a new episode. I'm Katherine Bliss, Senior Fellow with the CSIS Global Health Policy Center, and it's a pleasure to welcome Dr. Hanan Balkhy, Regional Director of the Eastern Mediterranean Regional Office of the World Health Organization. The EMRO region, as it is known, is one of the most diverse and complex of the 6 WHO regional offices. It has 22 member countries and territories that encompass a range of geographies, from North and East Africa to the countries of the Arabian Peninsula, to Syria, Lebanon, and Jordan, to Pakistan and Afghanistan. It's a region of socio-demographic contrasts, with countries classified as low and high income, and with very different health profiles. Some are still grappling with routine outbreaks of infectious disease, while in others, the primary concerns are chronic non-communicable conditions, such as diabetes and cardiovascular disease. Following her election as EMRO Regional Director, Dr. Balkhy assumed her role in February of this year. And while the headquarters of EMRO is near Cairo in Egypt, I'm not sure she's really had a chance to spend much time there, as she has made a number of missions to member countries since taking office. A pediatrician by training, Dr. Balkhy previously served as the Executive Director for Infection Prevention and Control within the Ministry of the National Guard in Saudi Arabia, and she recently served as the World Health Organization's Assistant Director General for Antimicrobial Resistance. So Dr. Balkhy, welcome to the CommonHealth Live.
Thank you very much, Katherine. I'm very grateful to CSIS for hosting me today, and I look forward to our discussion.
So thank you for joining us on this busy trip to Washington or to the United States. As you prepared to assume your new role at EMRO earlier this year, you outlined a vision for a diverse and complex region, encompassing the Atlantic Ocean to the Himalayas and complex humanitarian operations in Gaza, Yemen, Afghanistan, Libya, Sudan, and beyond. You've highlighted equitable access to health services, supply chain reform, strengthening the health workforce, and addressing the challenges of substance abuse as key priorities. So first, I wanted to ask you to share a bit about your vision for the region and how your recent travel has shaped your perspective on many of these challenges.
Thank you so much, and thank you for following what I'm doing and making it a bit easier for me to go into the discussion. Of course, the countries, as you mentioned, they're very diverse, and the vision in trying to serve the health and equity, and again reaching our SDGs, which is a very important goal for all of us, we have to really think out of the box. And in dealing with health for the past 20 years, I realized that health is not really an attractive topic. So in my vision, I'm trying to see what is the best way to link health with economic prosperity within our member states, even if they're small increments and alleviating a little bit of the unemployment in some of these very troubled countries. So in doing so, one of the first objectives was, or the first priorities and flagships on access and equitable access, how are we going to do that by not just asking for funds to purchase more medical countermeasures to give to the member states? How are we going to build their pharmaceutical and private sector capacity? And there are certain hot spots within the supply chain that the WHO can help alleviate. For example, the national regulatory authorities, that's something that we can help our member states to have higher maturity level, warehouses that can be in the region and sub-region, supporting the ideas of the private sector to produce more of the day-to-day needs when it comes to medical countermeasures. We should not need to bring PPEs, for example, from outside of the region, or the basic medications like Tylenol, amoxicillin, first-line antihypertensives, anti-malaria bed nets. So the idea is, and I find that our member states are very keen, and they become excited when I'm talking to them about how are we going to support them to ensure that the basic medical needs that they have are being produced either nationally or at least within the region. So it's from the region to the region. The second issue is the health workforce. The health workforce, there's a huge drainage in our region with the significant conflicts that we have. We have member states that have their talented health workforce up to 40, 50, 60% leaving the countries. So, and some of them are leaving the countries to neighboring countries. And then they're labeled as migrants or displaced, so they cannot use their skills, and the countries that are hosting them cannot utilize those skills. So how are we going to address the issue of the health workforce with innovative ideas and focused goals to ensure that the licensing and the practicing capacities of these individuals they're able to perform and work in the member states within the region, and also thinking of more innovative ideas of keeping them within their member states. A good example is about 7 or 8 of the member states are under significant sanctions, which means that the healthcare environment is not exciting. Doctors and nurses, they like to use their tools, right? They like to be able to treat their patients, make a diagnosis. So if they don't have their CTs or their X-rays or their diagnostic capacities, they're going to leave. If they can't do research, they're going to leave. So we're trying to put together a strategy that, again, has clear steps forward. On the last priority that you mentioned, which is the substance use agenda, in visiting my member states, I was able to see firsthand, because I made it part of my visits to each one of those countries, to visit the substance use hospitals and the mental health hospitals. We have the substance use issues vary from the different areas within the region. For example, in the further to the east of the countries like Pakistan, Afghanistan specifically, we have a large number of opioid and heroin addicts, which is, it's unfortunate for them. These are young women and men and families that have been exposed to this poison, and they need help. And we need to put together a good plan that can help them. And then we have the other synthetic narcotics that are available. And there's also the common overprescription of pain medications. So again, it's a diverse topic that will allow us to ease into the whole bigger agenda of mental health, yet tackle a topic that I see it as a pediatrician, as a mother, as someone who's dealt with this firsthand in emergency rooms. It destroys families, it destroys communities, and we're already suffering from conflict in the region. So that's where I came in understanding my region, the member states. They have strengths, they have challenges, so how are we going to salvage some of these problems from the region to the region?
So it sounds like you've really, got a couple of topics that can, involve a lot of cooperation, regulatory issues, licensing the health workforce so that people can move around, and then this issue of manufacturing. I want to ask about another issue that has touched different parts of the region at different moments. The EMRO region has for many years certainly been grappling with the ongoing transmission of wild polio virus in Pakistan and Afghanistan, while more recently the vaccine-derived polio virus has resurfaced in Gaza, which had been polio-free for a quarter century up until relatively recently. Of course, the conflict and deteriorating infrastructure really kind of created a perfect storm for that reemergence. During the negotiated ceasefires, health workers have been able to reach, more than 500,000 people, as I understand it. And, there's been a very successful delivery of that first dose of the vaccine, but of course now we're looking at the second dose in a few weeks. So I wanted to ask you to say a bit about the challenge of polio in the EMRO region how you're feeling about the recent campaign and what you're really going to be looking for over the next several weeks and months as the campaign kind of moves forward.
Well, thank you for bringing this topic up and also highlighting that it's been 25 years since Gaza and the occupied Palestinian territory has even seen polio. Of course, during my visit to Gaza during the month of July, I was able to spend 11 days in the West Bank and was able to enter into Gaza. It was not a total surprise. In fact, we were already predicting about the outbreaks and the infections that are being transmitted in an environment where you have destroyed infrastructure, running sewage in the streets, compiled waste and garbage, very poor hygienic situation, very poor wash and sanitation. When you have one shower for every 3,000 people, you know that there's going to be some problems emerging. A year has already passed by, and the primary immunization, which polio is one of them, has been very shaky and suboptimal. Where prior to October 7, the immunization rates were close to 99% in the children in Gaza. So I think I'm not totally shocked from a public health perspective. I think the teams on the ground have done significant discussions with our partners in creating that opportunity to have tranquility, to have this period of peace, to be able to vaccinate these children. It was a very, very challenging and difficult operation, I have to say, because day to day, the lack of understanding or knowing what's going to happen next. The health workforce and the healthcare facilities have been traumatized by the injuries that have taken place over the past months, and not knowing whether it's going to happen again or not. We're very grateful that nothing happened, and the campaign went forward quite well, but there were challenges. It was very difficult for the staff on the ground, and we're hoping for the second round, as you said, to move forward quickly. My concern as a public health person is that we've done this now and we're doing these 2 rounds, but that's not a solution for the polio not coming back. If there's not going to be a permanent peace solution and a ceasefire for this, what's going on, and rebuilding and rehabilitating the health care facilities, the sewage infrastructure, the hygiene of the environment, we will again be facing the same challenge with polio as we already are facing it with many of the other pathogens. So we need a more permanent solution so that the decades of work on eradicating polio, and as you mentioned, we're in the last mile. We have 2 more countries. I'm hoping really that we can eradicate it from Pakistan and Afghanistan, but this is also not going to help the situation.
So really a multi-sectoral approach to address not just the immunization challenges, but the larger infrastructure and environmental challenges in a post-conflict setting as well.
Yes.
On the issue of conflict, I mean, you've traveled at least 9 countries in the region this year. You've been to, you mentioned the trip to Gaza and the West Bank. You've been to, I think, Sudan, to Somalia. You've been, to a number of places that have really been in the throes of conflict in recent years. And in some of the writing that you've published before and certainly during some of these visits, you've really focused on the challenge of gender-based violence as a something that cuts across many of these different geographies and is in particular challenging for young women and adolescents in the region. And I wanted to ask you to say a little bit about the problem of gender-based violence and mental health that you've touched on a little bit here. What are the particular vulnerabilities of women and girls in conflict settings, and steps that kind of at a regional level can be taken to raise awareness of the issues and to improve cooperation to address them?
Thank you very much. Again, it's very tough to even fathom what a young girl or a female or even a young boy would be exposed to in such situations when it comes to gender-based violence. I think as a pediatrician, and I've worked in emergency rooms before, and I've seen cases of molestation, right? And I've managed firsthand families and patients who have been exposed to such trauma. And that's in the normal situation. So you can imagine under conflict, under, when there's a war happening, when there's conflict, the gender-based violence in some of these conflict areas is happening intentionally as a way of humiliation. It's a tool, it's a weapon for some of the conflict sides that they use against the communities. And for me to try to understand how will the WHO be able to support the victims of gender-based violence, but more importantly, what can we do to prevent it? And I think, first of all, I think we need to be talking about it more. When things are not measured, when we don't have stories about them, when we're not able to speak about it, then it's going to be very difficult to find solutions. So the first thing is I'm going to be, and I promised myself that I will be very vocal about some of the very difficult topics. Substance use was one of them, and gender-based violence is definitely another one. And I think that there's a role that the World Health Organization can do, and that I will do personally, to make sure that we bring these stories to the light so that people can understand that they are taking place. They will have lasting damage on the people that were victims of such atrocity. So I will make sure that we do speak about it. We will be, and we already have, and my predecessor has also have started it. WHO as an organization is very keen about addressing gender-based violence through working with our counterparts on the ground, making sure that there's education about it, but we also need to train the healthcare providers about how to manage such situations. The challenge that I see that I'm going to be facing is that when you come to some of the very difficult environments, such as Sudan or Gaza or some of the other areas, you're already talking about lack of the basic healthcare provision. And then you need to start training those healthcare providers on addressing a topic such as gender-based violence, which is not going to be treated or managed by a tablet, by providing a diagnostic kit. This requires long life counseling and rehabilitation of the individual. It would be really nice that we can find ways to further enhance international law that forbids such atrocities, and to make those parties accountable to their actions. That's something that also would be important for me to pay more attention to in the region.
When you were talking about the role of healthcare workers, it also made me think a bit about the challenge that female healthcare workers also face, just in terms of delivering services and the potential for violence that they also face. Is that also something that WHO can play a role in raising awareness about?
Absolutely, and we talk about all types of bullying and manipulation and mistreatment, and I think we have on the prevention and response to sexual harassment and exploitation, the WHO has a robust program supported by our member states. And during my visits to the different countries, we have certain our emergency countries and our countries with the most of the conflicts. We have specific staff that is their major role. That's what they're based in those countries to address, whether to educate the staff of the country offices, which can be very big and has a lot of national staff, and working with the other UN agencies, but also they are a resource for the ministries of health to support in bringing this specific agenda to the spotlight so that we can address it. So I speak with our staff, and the program is, I think, not more than a year old, so we're still learning. And if I want to speak very frankly, when you increase awareness and you don't have the solutions and the counseling in place, I expect, and my staff have told me that we're going to be facing some problems. So when you increase awareness on a topic and you don't have the solutions, that's a challenge as well. But I think going hand in hand, we'll try to build both capacities at the same time, increasing awareness, identifying what other resources we need to manage for the long term. But I think mental health specifically will require a lot of support for globally in general, but for the Eastern Mediterranean region, we will need to make it a very robust program.
So this is shifting gear a little bit, but as head of the Infection Prevention and Control Initiative in Saudi Arabia, during a period when Middle East respiratory syndrome, really was an emerging concern, you worked on MERS vaccine research, if I'm not mistaken. And in that capacity, you must have seen the importance of regular communication between animal health and human health over, especially given that camels can be vectors for the MERS virus. But, we've heard there's been so much important discussion about linking those sectors together. And yet here in the United States, as we learn about the challenges related to H5N1 influenza, and we know that bird flocks and dairy herds have been infected. There have been some human cases, but the communication, among the animal and human health sectors is sometimes more challenging than might be desirable. I just wanted to ask you for your perspective on the importance of that communication and what steps can be taken to really enhance awareness on both sides for overall public health.
Thank you. So, yes, the multisectorality of some of the health topics become very challenging, and the One Health agenda, if we like to call it, but it's really the multisectoral situation that needs to be addressed. In addressing that, one of the, so there's several global steps that have taken place. I think the communication between the different ministries becomes very, very important. During my role as Assistant Director General for Antimicrobial Resistance, we hosted, as a directive of the outcome of the high-level meeting in 2016 and the IACG, that there needs to be a quadripartite secretariat to be able to improve the communication between the international organizations that can then support the multisectorality on the ground. So we understand that 60, 70, sometimes 80% of the issues in the health sector need to be managed in other sectors: road traffic accidents, the zoonotic issues, substance use and trafficking, for example, and many others. So there are several things that become very critical and promising in trying to address these intersectoral communications. Number one, we're really trying to work with heads of states to ensure health in all policy. So in health and all policy, the accountability of the areas in the animal sector will eventually then lie with the ministry, the relevant Ministry of Agriculture or Environment or Water, of course, because they're different from one country to another. And then with that accountability, with that health and all policy approach to tackling some of these issues, then the teams of the different sectors need to sit together and say, what is it exactly that we're going to do, for example, for influenza in the animal sector? What are we going to do for antimicrobial resistance in the animal sector, in the environment sector, and in the water sector? So what I learned from my MERS experience is that the health people need to start moving into these other ministries in communicating with. I had an amazing experience between my institution, the Ministry of Health in the Kingdom of Saudi Arabia, and what is known as MIWA, the Ministry of Environment, Water, and Agriculture. And we had a joint venture in ensuring that we were running side by side for the MERS coronavirus. We were running and we were working with Sarah Gilbert from Oxford University because they had the Shadex MERS vaccine, and trying to implement the clinical studies for the MERS Shadex vaccine in the camels and as well in the human for the first ever phase 1 clinical trial of immunizations in Saudi Arabia. So we were ensuring that our FDA had that capacity. Now I'm talking that was 2015, 2016, building the capacity to have the oversight because we were doing clinical trials, but not vaccine clinical trials. And then we worked very closely with the Ministry of Agriculture to create, and imagine, the studies were done on camels. So you can imagine what the lab looked like. They were huge barns or huge spaces where we had to isolate the camels who were negative for MERS and those who were positive and look at transmissibility and effectiveness. So it's not easy to be done, but I think the more the other sectors understand the burden and the sources of these diseases, the more engaged they can be.
So some of it is really working together, but also understanding the culture of research and work in those different areas. Well, you brought up the issue of antimicrobial resistance. You were the Assistant Director General for Antimicrobial Resistance at the WHO. There was a meeting in 2016, the high-level meeting, and of course, next week, we're looking at another high-level meeting.
Yes.
So I wanted to ask if you could maybe look into a crystal ball or share a little bit and suggest what we might be likely to see coming out of the discussions next week.
So what happened between 2016 and next week or today to 2024, there was a lot of work among the quadripartite, specifically to increase that awareness of the use of antibiotics, specifically in the other sectors, and then also the waste management and the water and the environment. Bringing the information together at the same table, we had a lot of heated discussions, and we reached to some really good conclusions among the different sectors through those discussions. And we prepared ourselves over the past few years for this high-level meeting, and we realized that in order to move, well, first of all, we realized several things. Number one, we realized that the other sectors are very willing and very keen to address the issue of antimicrobial resistance because it affects animals. It affects, again, it's about economies, really. It's not about health. It's about economies. And the poultry farm, it's about the fish farming and even the small farmers, not even the large farming and meat production. I'm talking about even the smaller farms where you need to secure those animals for the livelihoods of people and for larger economies of even the highest income countries. So we reached to the conclusion that there's never going to be at the near future a time where you can have antibiotics that protect your animal sector that are separate from what is used in the human sector. So we're going to have to share this space. And if we're going to share this space, we have to put some rules and laws on how we're going to use these antibiotics. So the WHO has been working on the critical list of antimicrobials, the different types of pathogens, and to make sure that the agriculture sector is only using the ones that are not super critical for the human sector. So kind of understanding what can they use and what can they not use, and for them to be convinced and apply those rules and regulations. So what is the high-level meeting going to do? It's going to allow us to put those targets to reach certain targets within certain time frames on the use of antibiotics within the different sectors. We're also hoping that the high-level meeting, after all these years, and certain data has came out that the IHME produced in 2021, and now the Graham study has also produced some newer data, that the burden of disease is really not minuscule. You have 5 million per year, almost 4.7 million per year of associated death and 1.4 million of attributable death, and these are underestimates, if I would guess. So we agree that there's a huge burden of this disease. It's claiming lives, and we need to reach these targets in order to mitigate or bend the curve a little bit on antimicrobial resistance. So there's still a lot of work to be done, but with that acknowledgement, we will be hopefully making more awareness. Heads of states will understand that they need to implement their multi-sectoral national action plans. The WHO with the other organizations, we've worked really hard on trying to produce those tools for them to train leadership on antimicrobial resistance, to produce the guidelines for infection prevention control, for stewardship, which is proper use, and a lot of other tons of tools are there. The question is, are the member states going to use them to, and do they have the resources to implement these measures so that we can have better control over this phenomena?
Well, that meeting is in a week or a little over a week. And a few weeks after that, then you'll convene your regional committee,
Yes.
I think, for the EMRO region. So as you look ahead to that meeting and, of course, to the year ahead, what are the, I guess, top, what is the top aspiration you have for that committee's decisions and kind of the path forward into 2025?
For antimicrobial resistance or in general?
Well, for your committee,
Yes.
as you think back to
Yeah.
the EMRO region.
So going back to the holistic issues of the EMRO region, the regional committee this year will, of course, as usual, it will reflect on the achievements over the past year and look into the resolutions that have been approved by the member states. But we've spent the past 6-7 months to better understand how are we going to execute our flagship programs and what does it mean for the region. So going back to the issue of linking health with economy and addressing the critical issues of access, health, workforce, substance use within our general program of Work 14 in moving the region forward. I'm hoping to engage with our member states on commitments on how are they going to really own the process of their national regulatory authorities, for example. How are we going to work with them to create the regional and sub-regional warehouse and hubs? How are we going to digitalize those hubs so that we can better understand where do we have those weak points in our supply chain? How can we make sure that the region has enough production of the basic healthcare needs that one country that has access or excess of a product can share with a country that's soon to run out or is going through a major emergency like a flood or a conflict, which is always in one of our countries or another, there's something going on. So we need to be able to really own our processes in that matter and come up with the strategic decisions together. So it's it's a shared ownership of the regional committee mandate. And how are we going to move forward with our member states? So what I would love to see is commitment from our member states, and I hope that I will be able to commit to what I had promised my member states who voted for me to become the regional director. So I won't kid you, but I do feel a lot of pressure.
Well, it's a busy period, but it sounds
Yes.
like there are good opportunities for partnership, for solidarity, and for real, regional collaboration
Yes.
on many of the important challenges and resources in the region. Dr. Hanan Balkhy, Regional Director of the WHO EMRO region, thank you very much for joining me today, and good luck to you in this busy next couple of weeks and through the regional committee and beyond. Thank you very much, and thank you to our audience as well for joining this afternoon on the CommonHealth Live.